Hi everyone, I'm Gabby, the owner and clinical director of Recovered and Restored Eating Disorder Therapy Center. I am here today with our amazing clinician, Hannah de Groot, and she is just going to share a little bit about herself. So Hannah, welcome.
Hi, thank you. Good to be
Hi.
here.
Yes, I'm so happy. We had done a video on the formerly known female athlete triad, which is now called, what,
Reds.
is that right?
Reds, yes.
Friends. Okay, we did a video on that. So if you guys want to learn more about that, check that out. Hannah is kind of like our in-house athlete specialist, but I will let you take it away and tell us what you do at Recovered and Restored.
Perfect. I am a licensed professional counselor at Recovered and Restored, and I'm also the outreach coordinator. So most of my time I work with clients. I'm doing individual therapy, but I also meet with other providers and do some networking just to connect with other people so we can provide awesome referrals for our awesome clients.
Yes, yes. I love it. And people love meeting with Hannah. A lot of times people like follow up, email me and just be like, she was so awesome. And I'm like, I know. So yes, if you want to reach out and get to know us, please reach out to Hannah. She is amazing and great to talk to. So tell me more about your story, how you became a therapist, all the things. Let's let everyone get to know you.
Sure. How did I become a therapist? I literally think about that all the time. Like, how did I
How did
get
I get
here?
here? What am I doing? Right?
Yeah,
Like,
how did this happen? So I graduated from Penn State with a bachelor's in nutrition and a minor in psychology.
mhm.
Um, when I was studying nutrition, I knew I didn't want to be a dietitian. I didn't really want to go down that road. Just for me, as someone who is a pretty black and white thinker, it was really hard for me to think outside of like, as people with eating disorders or eating disorder histories know, like this is right and this is wrong. So
Yeah.
as I was like kind of exiting that phase of my life, I knew it wasn't going to be a good path for me to go down to be a registered dietitian. And I really loved my psych classes. I remember I had one professor who was like so life changing for me and just
Yeah.
opening that door.
I love that.
Um, so entering my senior year, I knew I wanted to go to grad school. So I ended up applying to Temple and a few others, but I chose to go to Temple, where I was in a master's of counseling, master's of education in counseling psychology program.
Cool.
Um, and I graduated from there in 2021. And I did my clinical experiences or clinical internships rather with the athletic departments at Temple University and University of Pennsylvania, where I was able to work with the athletes and provide counseling to them, which were both really, really amazing experiences. And coupled with Temple's commitment to social justice and inclusive therapy was just a really both all of them like very shaping in who I am as a person and who I am as a therapist. So to answer your question more directly, I am a therapist because I love helping people. I love connecting with people. Um, yeah, it just feels like a perfect things just sometimes work out perfectly for me.
Yes, yes. And like, yay for whoever that professor was that like invigorated you and kind of sparked your fire for psychology and counseling in the field. What class was that?
It was called Intro to Abnormal Psychology. It was like a
Ooh.
200 level psych class.
Yeah. Yeah.
And I remember he did like demonstrations and stuff all the time. And he would do, yeah, like demonstrations where I remember I was part of one that he like passed a Snickers bar around the entire auditorium and then like had me eat it in front of everyone to prove like some type of point. I don't really remember what it was, but there was another
Okay.
class where he brought like a massive like snake to class or something.
Ah, oh my God, my biggest fear. I would have
I think
died.
that's why, like, it was something about phobias to
Yeah, yeah, yeah.
elicit, like,
I
a
would have
fear.
died.
Yeah, I know, and I'm sure a lot of people in the class it was like a 200-person class too, like, I'm sure a lot of other people had that
Yeah.
experience,
Yeah.
um, but a good professor, I feel like, can change any type of educational path.
Yeah. Yeah. I totally agree. That's so awesome. I love that. Well, shout out to Penn State. Shout out Go Nittany Lions. Um, So yes, you have a lot of experience with athletes. You yourself were an athlete. Do you think that like being in sports and kind of like your experience in sports shaped your work that you do with your athlete clients?
Oh my gosh, 100%. I think my history as an athlete is one of the most important parts of who I am as a person. I
Yeah.
think being in sports as a child and even through being a young adult and even now I still consider myself an athlete has made me like driven and dedicated and taught me never to quit. Which those qualities all have their pros and cons, as people
Sure.
with eating disorders know. But
Yes.
that's part of why I love working with athletes too. Like when we have goals, we will get to them no matter what it takes.
Yeah.
Just so interesting from a psych standpoint
Oh
when
yeah.
it comes to like eating disorder recovery, how we can be so passionate about something and so dedicated to something, even if it hurts us, like something like an eating disorder might.
Yeah.
Um, so, as a clinician, when I work with athletes, I really like to channel those traits and talk about values and goals and help my clients use those characteristics that are like really fueling their fire and
Yeah.
help them achieve their goals in order to pursue recovery.
Yeah, that's awesome. I think athletes in particular are made up of something like really special. Everyone is unique and has special things about them, but I think people who are like dedicated athletes have a lot of grit. And I think recovery takes grit, resilience for sure, but also grit at times. And I think being able to channel that and help your clients channel that is so healing.
100%. I completely agree with that.
Yeah. So tell me more when you were an athlete and maybe you were struggling, what did you need to hear, right? Like, what are some of the things you impart on your clients? Like, tell us all the things.
That's a really good question. And I was thinking about that earlier, just thinking about, like, again, how I got here.
Yeah.
Um, to answer, so there's like, this is like a two-part answer. And the
Yeah.
first part is I think that when I was really in high school, like doing the most organized sports
Mhm.
that I had in my life, um, well-meaning coaches gave me a lot of uns- it was kind of solicited, but advice that was well-intentioned, but not helpful and definitely not in their scope of practice. Like I got a lot of nutrition advice
Yeah.
from
Yeah.
people
Me
who aren't,
too.
yeah, from
Too, as
people
a
who like aren't
cheerleader. Yeah.
dietitians or like
They're
and
it's mostly well-meaning, right? Like coaches are awesome people. This is not to like throw shade at
100%.
coaches, but it's like stay in your lane. And same thing in therapy, right? Like we stay in our lane. We're not going to treat people who are out of our scope. It's kind of the same thing. And I know, again, like so well intended. And maybe that worked for you.
Hmm.
That's awesome. I'm glad that you had a great performance. I'm glad that you were able to do XYZ and your body responded and you didn't develop an eating disorder. But a lot of times when you're saying these things to 15, 16, 17-year-old kids, they're going to do everything you say because they want to win. They
They
want to,
will lock in. They will
yes,
do it.
they don't have that flexibility. They have a lot of rigid thinking and like they don't know that like they can take a day off because you're not telling them that and X, Y, and Z. So like so well meaning, but like if it's out of your scope, just
Totally.
let's connect you with.
Exactly. And I think, yeah, so a lot of well-intentioned advice kind of didn't put me in the position
Yeah,
where I developed an eating disorder, but definitely didn't
maybe
help
contributed.
either per se.
Yeah,
Um, but I think that I would have really benefited from hearing you're not alone.
yeah,
Having mental health issues can be so stigmatizing and isolating.
mhm,
Um, and I
totally.
think I didn't really realize for a while that what I was feeling wasn't healthy. Like,
Yeah,
I think I didn't really realize there was anything wrong with feeling bad or anxious or upset all the time. But I think if someone had said to me, I feel that way too, it
yeah,
would have opened up a conversation about how we don't have to feel that way.
yeah,
Um, and maybe would have connected me with resources faster or changed the course of my life. I'm so thankful that I've had the experiences that I've had because they make me who I am today. Um, but I think especially for athletes who like we were saying, usually have a lot of grit and resiliency,
Absolutely.
are so used to just pushing through discomfort
Mhm.
because that's what we do as athletes to
Right.
get better at our sport. It's like push through when
Right.
it's uncomfortable.
Yep.
It's hard to imagine doing that in like going about it differently, which you have to in order to improve your mental health.
Totally. Totally. And it's so hard. So know that like you're not alone. If you are an athlete watching this or anyone watching this, you're not alone. I think one cool thing about like the generation after us, which definitely makes me feel old, but it is what it is. They are really great at being vulnerable. I think
Mhm.
they are really good at that for the most part. So like I think it is a lot more accepted to
Totally.
have anxiety or have depression or have an eating disorder. We don't want to glamorize those things, but know that like you aren't alone. I think it's like 1
100%.
in 5 people struggle with a mental illness, and that's like what's reported.
I think the statistic is actually the same for um, teenage girls struggling with eating disorders. It's one in
Wow.
five reports struggling, but
Yeah.
I actually agree that it's probably more and just underreported.
Yeah, for sure. So you are not alone. And also like the concept of like white knuckling it. Again, like, yeah, that's what you're trained to do when you're in sports. Like, oh, my ankle hurts, we'll keep running. Yes. And sometimes when we run on one of those ankles, it gets worse, right? So sometimes we do need to pause and like tune into our bodies and take care of ourselves. And that will only in the end make you even better as an athlete.
Speaking on coaches, I'm that's actually reminding of a great piece of advice that one of my high school swim coaches gave me. Shout out Jackie Hoagland.
Woohoo!
She when I would be like, so and so is hurting, she would say something like, "Is it what kind of pain is it? Is it?"
Mm,
And would channel um or which would make me think like, is it a stabbing pain? Is it like a dull pain? To just think more about what that pain feels like in my body so that I can figure out what's causing it. And
yep.
mental health is kind of the same, like figuring out what the pain feels like, taking a second to slow down
Mhm.
and sit with it for a second and understand it before you take the next steps.
Yeah.
Um, and figuring out, what's causing the pain so I know if I should push through or if it's better to address it in a different way.
Yeah. Shout out to Jackie. That is very wise. I love that. Yes, yes, great advice. Um, so tell us more about how your clients connect with you in a session. Like, what is it like to be your client?
Oh God, I don't know. We do
There
a
are certain people I would love to ask that question. I think you know who I'm talking about, and I would love to hear their answer.
I would be curious too. I mean, I think we do a lot of laughing,
Good. Yes.
maybe a little too much sometimes. I like
We
to
like to keep
joke.
it light. We're light and fluffy sometimes. We'll do the hard
Yeah.
stuff, but we'll keep it light.
Yeah, I like to provide empathy in a very humanistic way. I try to be really genuine. Um, I think I am a pretty authentic person. That's something I like really pride myself in, and it's important to me to like convey that to my clients so that they feel comfortable being authentic with me too.
Yeah.
Um, I like to approach sessions with a no BS type attitude, but also like keep it fun and make therapy like not super boring or super dry either.
Right. Totally. Totally. That's awesome. Like, we don't want therapy to be a chore. We want you to want to come talk to us. We acknowledge that what we're talking about is really challenging and difficult a lot of the times, but we want you to want to be here and because we want to be here.
True. Very true.
So, in addition to all the amazing, incredible work you do with clients and athletes, tell me more about what it's like to be the outreach coordinator, which like, thank you so much for helping me with this.
Oh my gosh, I love being that outreach coordinator because it's so nice to meet with other providers. I feel like since I spend most of the day like talking about eating disorder recovery or
Yeah.
mental health, like sometimes as everyone who's
Give me a
been
break.
affected knows, it's not always super fun. It can be really tough.
Yeah.
Um, Sometimes talking to providers can just like take the edge off a little.
Right.
Um, People who like have sat on this side of the screen or this side of this chair before really and know how it feels to be a provider And luckily, a lot of the people that we connect with also know what it's like to be the client, which is such a unique experience and something I'm so grateful for. I've been able to meet so many wonderful people who are like doctors, um, other therapists, dietitians, fitness experts, like people of all different career backgrounds to
Okay.
kind of help connect our clients with the best people.
Yeah. Yeah, that's so awesome. And also being able to share with them, like kind of how we said, working outside of our scope, sharing what we can do, as well as learning what they can do, so that like if the clients call us and maybe we're not the best fit, that's okay. We have trusted people we can send them to. And this helps us to create community, right? Which is
Totally.
like so important because like doing this, like we work virtually, so like it can feel kind of lonely. But when we know that there are other people kind of doing similar work or like different work, but you know, the same type of work, it's really a powerful, awesome thing.
Agree with that completely.
Yeah. So I'm so glad you do that. Thank you for doing that for us.
Oh, I'm happy to do it. It's fun.
Yeah, yeah. Does that tie into kind of like your social justice background, feminist theory, all the things? Does that get like your juices going a little bit?
Yeah, it's really important to me to connect with providers of all backgrounds.
Yeah.
Um, I always say to clients one of the most important aspects of recovery or strongest indicators of therapeutic success is having a really strong relationship with your therapist.
Mhm.
And oftentimes that can mean having a therapist with similar life experiences as you.
Sure.
Um, so it's really helpful and important for me to connect with therapists of all backgrounds, racial, sexual orientation, religion, um, anything really, body type, so that when we have clients who maybe don't feel like they can connect with me, which is totally fine and happens, I can send them to someone who I trust and think that they will have better luck with.
Yeah, that's so awesome. I love that. I love that. So tell us some fun things about you. We will wrap this up on a happy, super positive note. Tell us some fun things about you.
I I don't know.
I mean, I can say some amazing things about you, but I'll let you go
A
first.
dog who I feel like if you are listening to this video, you might hear her. Like all my
She is
clients,
welcome. If Daisy would like to join us, like Daisy can have her own video if she'd like.
it's a bit much when she when she joins. Um, all my clients know she like has this little game. She's so good. She's the best. She is in the room that's like directly above my head.
Yeah.
And
Yeah.
there's like a couch in the room. And so she sits on the couch with all of her toys. And she like drops the toys on the floor and then jumps off the couch and like picks up her toy and then like puts it back on the couch. Just so sweet. But like sometimes we'll be in counseling and someone will be telling me about something really hard and Daisy, my puppy, will be like playing this little game with herself.
Hey, yes.
Great. Also, like I can hear her like running around upstairs right
Yeah.
now, which I love how self-sufficient she is.
Yes.
I hope everything's up there is fine with you, sister, because I'm a little busy down here. Um, so she is like the best thing that's ever happened to me.
Yay.
I am a plant girl, as
Yes,
you
I
can
see your beautiful plants
tell.
in the background. You're a plant
I have,
mom, yes.
I have 4 down in this room. I probably have about 30 plants in my
Oh,
apartment.
okay.
Yeah, I like to. This is like actually one of my distress tolerance hacks. If you are someone who like needs to be doing something and can't sit still and
Mhm.
is used to like exercise compulsions or like cleaning or something like that you
Yeah.
feel like you need to be really busy, get plants and just fuss over them and just
Yes.
take care of them because they need you. And I think it's really fun. So I have I have a lot of plants.
I love that. That is like such a fun fact. You should know that like I can't keep plants alive to save my life. My mom bought me a plant, oh my gosh, when I lived in my old house, and it was like a plant you can't kill. And I
Mm.
killed it. Not intentionally. I actually like genuinely tried, but apparently I like overwatered it, which I was like, how do you
Mm.
overwater a plant? And she was like you did.
I
Like,
bet you had a snake plant. Do you know
Did
what
I?
kind of plant you had?
I don't know. Part of me thinks it was like a lily of some sort.
Uh,
She wouldn't buy me a snake plant. I don't like snakes.
oh, they're like the easiest to keep alive though. Maybe you should get one. No.
Mm.
Okay.
I think I like that was kind of my like sign that like I just it's not my thing, but I have like a great appreciation for like people that can do it because I think it's like one so beautiful. Like nature is so beautiful, and then to be able to like bring it into your house and like take care of something, I think is really awesome.
I read once that like having plants in your house can really help with depression with like
I think
something
that's true.
called
Yeah.
green or something like that. So I think that they just bring a little
Yeah.
life into my apartment.
They brighten up your day.
Yeah,
Love
exactly.
I love that. Well, is there anything else fun you'd like to share?
My always fun fact is I eat ice cream with a fork.
I love that.
Yeah, that's my
Awesome.
fun fact.
I have yet to try that. We've talked about this before, but I have yet to try it. It is definitely
Better traction.
it is on my to-do.
It's a good one.
It's on my to-do. I love that. Okay, perfect. Well, thank you for being here with us today. Thank you for sharing. If you guys are interested in services with Hannah, she is taking clients. Again, she does her best work with athletes, but she does see all sorts of populations and is truly an expert in our field. So reach out. You can reach out to her at hannah@recoveredandrestoredtherapy.com. You can reach out to me at Gabby at recoveredandrestoredtherapy.com or recoveredandrestoredtherapy.com, our website. Hit the contact page and I will get a message, or at Gabrielle LPC or at Recovered and Restored on Instagram.
Perfect.
Awesome. Have a great day, guys. Remember, this is not a supplement for therapy. Thank you so much for being here. Bye.